Hello, my name is Chukwunyere and I'm an Information Features Fellow, 2023 Information Features Fellow. Imagine a community that is being ravaged by a disease like hepatitis B. Just because one person contracted it, a young person, maybe 18 years, and because they are sexually active, they were able to just spread that disease across that community. Imagine 40 or 50% of that community, maybe a population of 1,000 people, and the young people there have what we call hepatitis B, because it was spread by or through sexual intercourse, for instance. Now imagine the future of that community. Imagine the next 10 years, the next 15 years, what that community would look like. Will they have healthy people? Will they have people who are even going to be alive in terms of that population group when they get older? This is what happens when there are information gaps within communities. This is what happens when there is health inequity within communities. Because I, at a point, was interviewing a young person who has hepatitis or who had hepatitis, and he was telling me that he couldn't actually access healthcare within his community. So he needs to travel for another 1 hour to where he could access healthcare. Now imagine the number of people who are sick within a community and can't access healthcare. They will need to travel to access healthcare. They will need money to access healthcare. So if these communities are impacted by a particular disease condition that could probably be terminal, it means that in the next couple of years, the population size of that community will depreciate as a result of mortalities. The population size of that community will be weak because you have a lot of sick people. So that's why I'm carrying out the project titled Using Youth-Led Innovative Approaches to Assess Health Information Needs and the Prevalent Disease Conditions across communities in Nigeria. This is focused on 7 states in Nigeria and the Federal Capital Territory, Abuja. We have 4 stages to this project. The first one is to recruit and train young people who are community influencers, who are actually doing things in their communities. We will equip them with the required knowledge, skills, and resources to be effective social impact leaders and people who can effectively conduct community needs assessments. The second thing is to conduct the community needs assessment itself. So I'll be working with them all the way to conduct the community needs assessment. And in doing that, we'll be able to find out the information that we need, analyze this information. After we've done that, the third stage is to conduct a co-creation workshop. Every of these individuals will come together, we will look at the data, we will look at the analysis and the report of these assessments as it is attached to each individual and their communities, and then we can create solutions based on this analysis that have been done. So the idea is that by the time we are done, we can now implement projects or implement these solutions within these different communities. So these are the 4 stages of this project. And so far we've been doing great. In fact, 40 young people have been selected based on several criteria that we use to select them. And we've been working with them, training them, and we are at that phase where we will start collecting the data. So working with these 40 young people, we have identified 40 communities across 7 states and the Federal Capital Territory, Abuja. And we're going to be carrying out all of the research that we've designed that we're going to carry out, collect data and work with this data to be able to prefer sustainable solutions that address health information needs across these communities. I'm really excited about what we are trying to do now because we have tested the data collection platform and you guys provided the feedback that helped us to improve on it. And we've done a test run of the data across some of these communities that have been collected. And using that test run, we found out that there are certain key things that are solutions that are fundamental across these different communities. So one of it is using social media as a tool for addressing health information needs. The other is using a website which would have information about health and disease conditions that can actually address health information needs for the layman. So we're going to be breaking down health information in basic, culturally appropriate formats and also in local languages that anybody can understand, and it will serve as a repository for health information. This is just one of the solutions that we would develop. So we're just using this because while we are waiting for the data collection to be done, we are using this period to just see how we can create this solution that we have identified based on the test runs that we've done. So I'm looking forward to what the data analysis and what the data collected at the end of the day would be like, and then we can come back again to co-create sustainable solutions or local solutions that can address these health information needs. So I welcome you to today's meeting, and I encourage you to be open-minded. I encourage you to think, because we are going to brainstorm. We're going to work together as a team to develop communication products that will address health information needs across our different communities. So enjoy the day, and thank you very much.
Thank you.